Now, this is a very interesting MRI of the brain. You can simply pause the video and you can try to find out what is the problem. We know that this is DWI imaging. DWI is diffusion weighted imaging, and this is almost always done only and most of the time to see an acute ischemic stroke, because any time any patient presenting with new onset focal neurological deficit, the first always suspicion is either it is ischemic stroke or hemorrhagic stroke. So this DWI imaging will tell us whether the patient has acute ischemic stroke or not. Now it will appear hyper intense or dense white. We can very clearly see on this DWI imaging. So, a very hyper intense or dense white on DWI, and exactly on the same position or same location, if it appears dense black on ADC, that is afferent deficient coefficient, we say that the patient has acute ischemic stroke of mostly less than 7 days duration. So, in here, what we are saying is that the patient is having acute ischemic stroke, and this is involving the posterior circulation. Posterior circulation, this is the occipital lobe. This is the occipital lobe where there will be involvement of vision, and most of the time the patient will have homonymous hemianopia, means the only one side of the vision will be lost. So if the patient has left homonymous hemianopia, if the patient has left homonymous hemianopia, the patient will not be able to see on left of his side. So if we put like two fingers in front of him towards the left side, the patient may be able to recognize only one. The patient may see only one finger and he may completely not see the other finger. So in this particular MRI, we are very crystal clearly able to see this presence of involvement of this occipital cortex. This is all occipital cortex, which is linked with vision. And very commonly, you can see there is hyper intensity of this structure also here also. So compare this on this side. Here it is normal and here it is hyper intense. There is diffusion restriction. This is typical thalamus. So to recognize thalamus, this is one of the best slide. We can see these are the two ventricles. This is the first ventricle, this is the second ventricle. This portion here, this small almond shaped structure is caudate lobe, and exactly backside of it, this portion is all thalamus. And this typical structure is the putamen and globus pallidus. This structure is putamen and globus pallidus, which is also called as lentiform nucleus. And in between this caudate and this thalamus and this putamen, this structure is internal capsule. So there is hyper intense involvement, or there is acute infarct in thalamus as well. So this is very typical of posterior circulation stroke, because these will involve the structures backside of this. So you can very commonly see the involvement of the cerebellum. You can see very commonly involvement of this pons. You can very commonly see the midbrain. You can very commonly see the medulla as well. So involvement of all these posterior structures is seen in posterior circulation stroke, where thalamus involvement is very common. Now this imaging is Flair imaging. Flair is fluid attenuated inversion recovery image. So fluid attenuated means where the CSF, which appears white on T2 imaging, is made black. So that is inverted image, and this image which is taken up is T2 flare. So this T2 flare has one peculiarity. T2 flare or flare imaging will pick not only the new lesions, but it will also pick the all old lesions, that can be all ischemic strokes. So it will definitely pick not only this DWI will pick only and only new ischemic strokes. So we may not know the old ischemic stroke, but this flare will tell all the new as well as old lesions. There is one benefit of it, that we can see that the patient has extensive bilateral periventricular ischemic changes. These will appear hyper intense or dense white. So these dense white lesions means these are all old ischemic insults which are very very clearly seen on the flare imaging. And here we can see that there is hyper intensity on the exact same position of this. So this correspond to this and this, they correspond to the same lesion, means this is a new lesion. Now we must know that uh, flare picks up the lesion if the lesion or the ischemic injury has been there at least for 4 to 6 hours. So we can utilize this for the wake up stroke. Whenever any patient presents in the hospital with wake up stroke, then we actually don't know ki after before how many hours this patient had ischemic stroke. That time we can do MRI brain with flare, and if the flare does not show these ischemic changes, if the flare does not show this hyper intense lesion, it means it's been less than 4 hours, and that patient may benefit by thrombolysis. If flare already shows that there is hyper intensity, it means ki the ischemic stroke has been there for more than at least 4 to 6 hours. So the patient is already out of window. So such patients we don't thrombolize. So flare can be utilized for looking new lesions, old lesions, and whether to go for thrombolysis or not, especially if the patient presents in window period. So this was excellent MRI with posterior circulation ischemic stroke. Thank you.